Welcome to Case Management and Documentation, Addiction Studies. Hi, I'm Sherry Washington, and I'll be discussing this week's textbooks readings, Chapter 22, Documentation and Recording. Documenting. Now, documentation is the action of recording information about client contact, assessment, and services. Regardless of the professional career choice with human services or even the agency of employment, all case managers should make a habit of documenting and maintaining records. These records will reflect all relevant client contacts, which include office visits, phone calls, and collateral contacts. But why document, right? Documentation, no lies told here, is annoying. Nonetheless, it is a legal necessity, as it's going to serve as a written declaration of work with the client and that services have been provided to that client. That way, our agency or ourselves can actually bill for those services. If there's no documentation of our interactions with our clients, then simply our interaction didn't occur. Documentation can also assist case managers with information of past events. Considering that the case manager will have more than one client, it's going to be fairly easy for us to forget or even mix up experiences and events. Documentation helps us avoid that. We never want to rely on our memory. Well-written and comprehensive documentation will provide accurate information, and that's going to be useful when we need to review or even someone else needs to review the client's file and follow up with the client for us. Before I jump into talking about the different types of documentation, I want to start with aspects of documentation that should and should not be included during the documenting process. Now, most of our documentation will be focused on the client and the interaction we have with them. The case manager should document the most important things that have occurred during that interaction, even if the interaction wasn't verbal. The documentation will include what happened during that interaction and what was observed. Quotation marks in our documentation should only be used to indicate a contact or client's exact words, and not a summary or a paraphrased version. For example, in an interaction with the client appears distressed and is pacing back and forth as they discuss their work schedule. They state that their supervisor did this to them purposefully, and that the supervisor is a really mean guy and hateful. The documentation may look like this. We may also note some aspects that are extremely significant. These are going to be clues regarding the client's state of mind or their situation. The chart here displays some aspects that may be significant. Some significant aspects are appearance, dress, facial expressions, attitudes concerning the services to which the client was referred to, cognitive problems, responses to others or to activities, participation concerning interactions with their case manager, attitudes concerning interactions with the case manager or their participation, participation in the services to which the client was referred to, as well as mannerism. Now, working in human services often means we are dealing with the attitudes, behaviors, and emotions of our client, as well as ourselves. Therefore, we are subject to feeling annoyed, angry, or even hostile towards our clients. We should never use our documentation as a place to release that hostility. When we are angry, that emotion can reflect in our actions or attitudes, and it may sound sarcastic, facetious, or even annoyed with the person. As well, it can also lead us to display negative feelings that we have about our client, potentially indicating a problematic issue within our collaboration efforts. Let's say, for example, a depressive client continuously promises to pick up their prescription, but they've missed several appointments. Upon interaction with the client, a human case manager who is frustrated or annoyed may write, Abdul, case manager, agreed he will come into the office to pick up his prescription on Monday, 8/15, 2025, if he can manage to get out of bed. As you can see, that last part was negative. It was a little sarcastic, and it doesn't belong in our documentation. Case managers should also refrain from being judgmental in their notes. Notes follow the client and can lead to the client being prejudged before a person even talks to them. Figure 22.4 has a list of words that sound judgmental and a substitute that is more objective. Let's say we're dealing with a client who has expressed that they may be depressed. Upon meeting the client, we notice that they don't smell the best and their clothes are not well kept. Instead of stating that the client is dirty, we may state in our documentation that the client had poor hygiene or unclean habits. Let's take another look at an example. Let's say we have a client who is telling us a story about a mistake or an intended action that they have done, which we don't really believe was the best decision. Instead of writing that the client is foolish, we may write that the client used poor judgment. Pause the video, look over the chart. Think about other situations that come to mind in which we can replace poor words of documentation for words that sound more objective. To maintain professionalism, our documentation should be clear and precise. This means that our notes must be well written and comprehensive. Vague notes or general descriptions will not provide the clarity we need and can leave many questions unanswered, leaving gaps in timelines. Case managers should avoid vague terms or indefinite statements. This is going to assist if notes are ever reviewed or if someone other than us needs to follow up with the client. Let's take a look at a vague note. Raul was upset today. How many of us have questions about this? Why was Raul upset? What happened? A better note may seem or show Raul expressed disappointment in the timing of his recovery today. That is letting us know what Raul was upset about, as well as the interaction between the case manager and the client. Being clear and concise in our documentation includes avoiding contradictions or gaps. Therefore, when there is a change that varies from previous interaction, an explanation should be provided to clear up any contradictions or entries before. These could be changes in the plan, significant developments, regardless if they are negative or positive. Notating the explanation of the change assists with the accuracy of client records. Let's go ahead and take a look at an example that wasn't so great. Ms. Hines will begin outpatient therapy on 6/7/2025. The next documentation states that Ms. Hines is currently living at Sunnyview Rehabilitation Center as of 7/25/25. We don't know what happened here. If the case manager had actually documented what happened in between, it would give us an idea of why Mrs. Hines went from outpatient therapy to rehabilitation center. Clients have the right to access their records. This is yet another reason to ensure the accuracy and timeliness of our documentation. It also gives reason to ensuring our notes are straightforward and easy to understand. This may mean avoiding professional jargon or office lingo within our notes. Let's take a look at this example. Ms. Hines came to the office to request a D-2653 to authorize therapy for her child. SUP previously approved. Anybody know what a D-2653 is or what a SUP is? Let's look at this journal written in a different way. Ms. Hines came to the office to request a referral, D-2653, to authorize therapy for her child. Social supervisor Nyla J. previously approved the authorization. That's a little bit easier to read, right? Our notes should be free of language that may appear insulting. Therefore, when talking about clients with disabilities, we should use language that accurately reflects their circumstances. These individuals should be referred to as a person with a disability. The rule of thumb is to acknowledge the individual as a person before acknowledging their disability. This is going to prevent from labeling them in a pejorative manner. Terms that have negative connotation, such as afflicted with, suffering from, cripple, or victim, can induce pity, emotionalizing the disability. Some other examples may be to say a person who is deaf instead of a deaf person, or a person with a visual impairment instead of a blind person. When writing our case notes, we want to be able to distinguish between facts and impressions. A fact is something that we've observed, whereas an impression is a clue we picked up from the person. When writing about impressions, we should use words such as seemed, appeared, and felt. Let's take a look at this example. An impression. Bart appeared angry. If we are writing the fact, we would say that Bart was yelling and throwing things across the room. Because our notes are written objectively, we will need to write a balanced picture of the client. We never want to give off the idea that the client is entirely positive or negative. The note should include the person's strengths, weaknesses, positive gains, and negative problems. In previous chapters, we discussed developing a plan with our client in a collaboration effort. Our documentation should reflect that the plan was developed with the client and that the client has agreed to the plan. As well, documentation of an agreement with a referred agency should be noted. This will include the type of services and the provider of those services. During our monitoring visits or site visits, if there has been a meeting that was attended by the case manager, it will need to be documented. Anytime a meeting is set to speak with the client, it should be documented, especially those that are specifically scheduled to discuss the person's goals, plan, or treatment. Whenever we receive a new client or a client that had a previous case manager, we should review the notes. This is going to provide evidence of their previous plan and the client's involvement. If there isn't any notes, then we want to inquire about that. Remember, if it's not documented, it didn't happen. Therefore, document, document, document. There will also be times where plans have to change. This could be due to the client becoming sick, the provider is closed, the plan is too difficult, or it's not addressing the real issue. This must be documented. As such, whenever there is a lack of progress towards the goals or plans, the case manager must note the inactivity towards the goals, the reasons of why, note the revision to the plan, and the revision of service or treatment plan. Let's take a look at this example. Ms. Hines can no longer attend therapy at Lakeview Behavior Services as they are no longer accepting her insurance. Case manager and Ms. Hines reviewed other options that were available. Ms. Hines agreed to go to Palmdale Therapy and stated it was closer to her house. Phone contact with Palmdale Therapy confirmed a scheduled appointment on 6/5/2025. Ms. Hines will call case manager on 6/6/2025 to confirm the appointment's success. All right, now that we know what should and should not be included in our notes, let's talk about some of the different type of notes. We're going to start off with contact notes. When we document or write our contact notes, we must label how we interacted with our client. These interactions can be through collateral contact or contact with someone other than the client, such as the client's mother, minister, or a nurse. An office visit, where the client was seen in the office. A phone visit, and this is irregardless if the client called us or we called the client. A site visit, where we go to see the services that our client are receiving and evaluate or discuss those services. Group visits. This is where we're going to see our clients within a group. Sometimes this makes it more efficient for us to see more than one client at the same time. And as well, home visits, when we see the client in the home. Contact notes record contact that we have had with our client and will include the focus of the contact, whether it was a formal interview, a follow-up, or a conversation, for example. The assessment of the situation based on the summary of behavior, appearance, and effect. Resolution, whether this is the service provided or the initiated plan. And the reason or need for the next follow-up. As I stated earlier, anytime we are writing our notes, we want to be concise. That way, if needed, whoever needs to have access to our notes will know what's going on. Let's take a look at an example of a contact note. So as we can see, the first thing that we see is focus of the interview. Linda came into the office today to discuss her medication. Your assessment. She appeared somewhat disheveled and tearful and indicated her belief that the medicine is not strong enough. Notice that there are quotations in regards to not strong enough, which indicates that those were Linda's words. The resolution. An appointment was set up for her to see Dr. Whitworth on July 2nd. She was advised to remain in her program where her depression can be closely monitored. And lastly, we have the reason for contact or the reason for next contact. Linda will return July 2nd after her visit with the doctor to let the case manager know what was done about her medications. Now that we have an idea of what contact notes are, let's look at some scenarios and identify the 4 different aspects. 11326 phone. Mark called today asking for a voucher for public transportation in order to get to Polyclinic Medical Center for kidney dialysis. Suggested he go by county transportation for more direct service. Mark seemed bright and pleased with the results of dialysis. He will call next week to confirm that the county transportation has begun to pick him up. Go ahead and pause the video. See if you can identify the 4 parts of this contact note. Were you able to identify all 4 parts? Let's take a look. The focus of the interview. Mark called to request a voucher for public transportation to get to and from dialysis at Polyclinic Medical Center. The assessment. Mark sounded pleased with his dialysis treatment. The resolution. Suggested he go by county transportation for more direct services to dialysis, and Mark agreed. The reason for the next contact will be Mark will call next week to confirm that the county transportation services has started. Seems simple, huh? Let's try one more example. 5/3/2027, office visit. Jill came into the office this afternoon because she's out of medication and did not renew her prescription at the time she was given a voucher to do so. She states she wanted to try to go without medication at the time. Jill denied having any symptoms of her schizophrenia, but seemed agitated and impatient. She paced the office and at one point attempted to remove her blouse because it's so hot. An updated voucher was given to her in order for her to refill her prescription for Seroquel. She will refill her medication today and call case manager tomorrow to report how she is feeling. Go ahead and feel free to pause the video as you identify the 4 parts of this contact note. Were you able to identify all 4 parts? Let's take a look. The focus of the interview. Jill came to the office as she was out of medication and needed a prescription refill voucher. Your assessment. Jill appeared to be agitated and impatient, however, denied experiencing symptoms of schizophrenia. The resolution. An updated prescription voucher was provided, and Jill stated she will refill her prescription today. Reason for the contact? Jill will contact case manager tomorrow confirming her prescription refill. Documenting service monitoring. There will also be times when our contact notes will include documentation of service effort monitoring. This is checking up on our clients during services that we have established for them within their plan. We must document proof that we are monitoring our clients' services and progress. If we talk to any professional or collateral contacts during the services regarding our client, we must also identify them and document those interactions within our notes. For example, if you visited the site of a referred provider agency and talked to the client, it may look like this. 12/15/2024, site visit. Met Jason at Mountain View Clinic for his therapy with Anna Boyd. LMFT. Jason appeared to be happy with his progress, but felt that he needed more time with his therapist. Ms. Boyd agreed. Authorization sent to Mountain View Clinic to increase sessions from 30 minutes to 1 hour. Case manager will call client within 3 days to discuss approval. I want to touch on 2 other formats of client contact documentation. This is going to be SOAP notes and DAP notes. They're very popular formats to document client contact and their progress. Many individuals in the medical field use SOAP notes. SOAP is an acronym that stands for Subjective, Objective, Assessment, and Plan. When we're looking at the subjective part of SOAP notes, it means we're recording what the person and those associated with the person are saying about how the client is doing. When we look at the objective section, this is information that we can verify or factual information. The assessment is how the case manager interprets the subjective and objective information. And then we have plan. And this is what has been recommended or decided on to help our clients progress. It is also going to include topics to present for the next discussion. Let's take a look at this SOAP note example provided by Power Diary. Subjective. Jessica reports that she is feeling good and enjoying her time away. She states that she has been taking her medication as directed and uses her meditation app whenever she feels a bit anxious. She denied any thoughts of self-harm or feeling low in mood recently. Objective. Jessica could not attend her session in person as she is on a family holiday this week. She was able to touch bases with me via phone and was able to make the call at the set time. Jessica presented with a relaxed mood. Her speech was normal in rate, tone, and volume. She was able to articulate her thoughts and feelings coherently. Jessica did not present with any signs of hallucinations or delusions. Sleep and appetite are good. Insight and judgment are good, and no signs of substance use was present. Assessment. Jessica sounded calm and positive over the phone. She is progressing well in managing her anxiety with her relaxation strategies and spending time with her family. She remains compliant with her medication. And now the plan. Plan to meet again in person at 2 p.m. next Tuesday, 25th of May. Jessica will continue on her current medication and has given her family copies of her safety plan should she need it. And then we have DAP notes. So DAP stands for Data Assessment and Plan. DAP notes are typically favored by mental health professionals, and this is because it combines the section of objective and subjective material into what they call data. The sections of assessment and plan are the same as with SOAP notes. DAP notes are often briefer than SOAP notes as well. Let's take a look at this example of DAP notes provided by Power Diary. Data. Second follow-up session today. John was calm and composed with good eye contact and rapport established. He confirmed that he's been following the relaxation strategies I provided him in the previous session with good effect. States his mood has improved and able to relax after work more easily. Despite this, John reported ongoing regular occasions where he can't initiate sleep at night due to anxiety. He's worried about his mother's ill health. Advanced cancer is contributing to his sleep difficulties. Assessment. John has made significant gains since his last session and is applying provided strategies effectively. John's concern regarding his mother's health is understandable. However, he appears to feel an excessive level of responsibility for her care, which is exacerbating his anxiety and contributing to his initial insomnia. Discuss this with John and together identify realistic limits to the care he could provide. John engaged well in this process, and it appeared to reduce his concerns in this area. Plan. Review in 2 weeks. Assess if anxiety and sleep improved following today's session. As stated earlier, SOAP and DAP notes only differ in the subject objective and data section. Typically, SOAP notes are used by medical professionals, while DAP notes are used by mental health professionals. Go ahead and pause your video for the moment and review the SOAP note and the DAP note for the same client. Let's dive a little bit deeper into writing the assessment section. For both SOAP and DAP notes, they should include or answer the following questions. Do you think the diagnosis is a correct one, or do you feel a reevaluation is needed? Is this person cooperative and motivated, or does this person seem to have good insight? In other words, what is the mental status evaluation of the client? Do you see progress or were there setbacks? Describe those. Is the person able to follow through on goals and objectives you set together? Or is this person failing to meet these, indicating a reevaluation of goals and objective is warranted? How did the person respond to the current session with you? Did they leave upset? Did they appear to be relaxed? Were they pleasant or were they irritated? And what does the person need to address to improve their situation? When writing the plan section of SOAP or DAP notes, case managers should elaborate on the next steps. Here, the case manager can include any referrals they're making for their client. Indicate if they've helped the person decide where to go to solve a problem. Changes they have made to the plan or the goals and objectives that they've developed with the client. What they and the client think should be addressed next, and what the individual has agreed to undertake to accomplish that, and when and what will be the purpose of the return visit. Regardless if we're writing using SOAP notes, DAP notes, or just contact notes, we must follow all government requirements. This will include any local, state, and federal requirements for reimbursement, as well as legal documentation requirements. Many computer applications for documenting address the minimal legal requirements. However, This is also dependent on the type of applications that are used. Whenever we are handwriting our notes or our documentation, we want to ensure that we're using black ink, as blue ink doesn't often copy well and pencils are not allowed. We want to write legibly. We want to make sure we're never using correction fluid. If a mistake is made, we're going to go ahead and draw a line through the error, write in the words above the line, and sign or initial next to it. As well, the client's name should be on each page or the agency's number if required. When we are recording our notes, the date of contact must be in the margins. Every note must be signed. As well, it should be dated. This should be done close to the day that the client was serviced. Lastly, if the person has ongoing services, the note must state their next appointment or service date. Any remaining blank pages should have diagonal lines across it, which indicates that there was no information for these pages. That concludes the lecture for documenting and recording. Until next time, bye.